Hello there! Welcome to my show, COVID-19 Update by Heerak. And it's October 16, 2020. Yeah, we're nearing Christmas season. It's exciting. Um, yeah, we have some major holidays before that, like Halloween, end of this month, and then Thanksgiving next month in November. And like a month later, we have Christmas. It's my favorite holiday. A lot of songs that you sing to, a lot of great Christmas specials. I don't know how it's going to be this year with COVID-19 having proliferated since like March. If there's going to be a lot of great Christmas specials, hopefully there are. Um, yeah. So you need to decorate your Christmas, house in Christmas with like a Christmas songing. Uh, the last Christmas, I decorated my door with this cool stocking with a cute dog on there. Um, but if you're a cat lover, you can also decorate your door or house with cat Christmas stocking. You know, um, we have a new RN resident in our cohort at Virginia Hospital Center, and she says she has two cats. Yeah, so she'll probably decorate it with one of these or maybe two of these. Or maybe she'll have one of this for one of her cats and then another one for another cat of hers. A lot of my friends have cats. They have as pets. I mean, they're easy to take care of because you could keep the cat inside. You don't have to walk the cat at all, like a dog. But in my apartment building, I kid you not, um, there is a lady who has a cat, and she dresses up the cat like you dress up a dog, and she has a leash around the cat. Yes, she has a leash around the cat. The cat kind of looks like this, this kind of cat. And she walks the cat outside. She's probably watching the show. But I was like, huh? I had like a second take, like, I'm like, is my eyes fooling me? Is that a cat or is that a dog? Because I've never seen anybody walk a cat with a leash. So yeah, I mean, I had to like take a second look. It was like my apartment building front door. I was like, whoa, and it was early in the morning, so I was like a little bit, I wasn't fully awake. I haven't had my first cup of coffee yet. So yeah, it was like a second take. you know, oh my gosh, but I guess it makes sense. Like if you have a cat who's domesticated but could run away, you don't want your cat to run away, so you put a leash on the cat and you walk it. I guess. I mean, I've never seen it before, but I mean, I guess you can put a leash on any animal, right? I mean, if you have a rabbit, you could probably put a leash on rabbit. I mean, I've never seen that either, but I've never seen a leash on a cat. But I thought it was kind of neat. But you don't actually have to walk the cat. Um, you put the cat inside home and the cat will run around. And cats are kind of, you have a litter box and you train the cat. It's not that hard to train. The cat goes there, it's easy to take care of, I I don't have any animals at home. I love animals, cats, dogs, all kinds of animals. I love koala bears. I guess they're not really domesticated. They're kind of wild. And I got to pet a koala bear in um, Australia when I went to Australia with my best buddy from middle school. And Mosang, we did. We actually met up with our Christian Mingle dates. Because both of us were in Christian Mingle. And this was when Ed was single. He's now happily married with Karen Middleton, who was an elementary school teacher in Fairfax County Public Schools for many years. When Ed was going to law school at George Washington Law School, I mean, she was a teacher at Fairfax County Public Schools before she married Ed Musang, but now she's Karen Musang, but they're in Illinois, and yeah, Amanda May Musang, the firstborn is like my goddaughter. So yeah, but there are a lot of they're great parents. They're both blonde and blue eyes. All their children are like blonde and blue eyes. Um, Ed is predominantly Norwegian, but German and Romanian as well. Karen is like mixture of German and English, I believe. So I think there's spattering of other European descent as well. But yeah, so Karen Nettleton, or now Karen Mosa, is from Long Island. Both of her parents were they're either librarians or teachers in New York public school system. Yeah. So, but anyway, yeah. So she's my sister's best friend, and Ed's my best friend. So we set them up, and it took us a long time to get them to tie the knot. I mean, we introduced them, and like we had to work at it. My sister Vicky and I, we had to work at it for like years to get them to actually tie the knot. I'm like, geez, and it's so different from like Joe Garver, who's like one of the three musketeers from middle school. We used to eat lunch together every day in the Philmont Christian Academy cafeteria. And Joe Garver went to 10th Presbyterian Church. He still goes to 10th Presbyterian Church. He's a deacon there, professor of philosophy at LaSalle University. Um, and I guess he went to the singles group at 10th Presbyterian Church. And I guess that's one of the great things about going to a big church with large singles, a population, because you can find your wife there. A lot of people, young people go there because of that. I mean, obviously, if you're a Christian, you want to marry a Christian. Church is the best place to find them. So Joe went to a singles group, and he saw, his future wife there, and they started dating. And he was married like within 1 year of starting to date her, like officially as a girlfriend. And I mean, that's how long it takes. Like Mike Mukosian, who, whose wife is a Kaiser Permanente uh, physical or occupational therapist for like decades. They married after they met for 1 year. Both um, Michael Mukosian, he's an Orthodox Presbyterian Church clergyman, and his wife went to Orthodox Presbyterian Church. And so Michael's really happy because she's thin, blonde, beautiful, and and so that's what she wanted. And so God gave him what he wanted, I guess. But yeah, but yeah, but Mike Matossian also took one year to get married. So I was the best man at Mike's wedding. I was like the usher at Joe's wedding because Joe got a best man at Penn, Paul Dugan, and his wife works at University of Pennsylvania for like decades now. So, but Paul Dugan, um, I guess Paul Dugan was at Penn too, and they were both active at InterVarsity Christian Fellowship. There are a lot of pretty girls at Penn InterVarsity Christian Fellowship, but none of them worked out for Joe. But I mean, he ended up with a great woman, so Joe's happy. But yeah, she's really pretty. She's like English. She comes from a family of like 12 and Episcopalian. But yeah, Joe's wife. Um, yeah, but she was at 10th Presbyterian Church, and so that's where they met and got married. Actually, it's funny because her brother married an Episcopalian priest who was a theologian, and I actually met her at Society of Biblical Literature annual meeting. Like every year, there's a big conference with like 10,000 theologians, and I presented a paper at a Society of Biblical Literature meeting, and this was in Atlanta, Georgia. And I met up with her, and we had lunch. And guess where we had lunch? We had lunch at Hooters. Yeah, she and I. It was just her and me. We had lunch because we were just catching up. But Hooters was the closest restaurant, I guess, from the conference center. It was, um, yeah, it was, but yeah. So yeah, it's a small world. Everybody knows everybody. I'm sure there are people at Virginia Hospital Center who knows Joe Garver. I'm sure there are tons of people at Virginia Hospital Center who knows Ed Mosang and Karen Nettleton, because Ed was here for 3 years at his George Washington University Law School, and then he worked for U.S. Department of Labor for several years. So he's been in this area for a long time, going to a Lutheran church here with Karen. Karen's Lutheran, Ed is Primitive Methodist. They're like Evangelical Methodist. And then, you know, Ed decided to go to Lutheran church with Karen. So they attended this Lutheran church for many years in this area, in Fairfax County area. And they're Missouri Synod Lutherans. So there are three different types of Lutheran church. ELCA, which is the largest denomination, Evangelical Lutheran Church of America. That's where my close friend Eugene Geiser, my friend from the University of Pennsylvania, who I encouraged to go to seminary. He went to Philadelphia Seminary, which is an ELCA seminary. He became a pastor there. Married a woman from an ELCA church where he was a pastoral intern while he was in seminary, and she's like 100% German. He pastored interned at a 100% German-speaking church. They only speak German. There are churches like this. And he was telling me that there are two churches like this in Pennsylvania, in Philadelphia area, but I think there's more in other parts of Philadelphia. But yeah, so small world, you know. So Ed and Karen Wilson were here. So I'm sure there are a lot of people at Virginia Hospital Center who knows them, you know. People at Fairfax County Public Schools, I'm sure they know Karen Nettleton, Karen Mosang. You see as a teacher for, I guess, maybe like even over a decade. Yeah, in Fairfax County Public Schools, so maybe around a decade. So I'm sure she had like a lot of students and parents who know her. But yeah, so Virginia Hospital Center, you know, we're like a couple miles from Fairfax County, because Falls Church is Fairfax County. And I'm like on the Arlington and Fairfax Falls Church County line, Falls Church City line. So like I'm like probably less than a mile away from Fairfax County, you know, a few blocks from Fairfax County. So I'm sure a lot of people, doctors and nurses and people who know the people I know, you know. Um, yeah, I mean, it's a small world. The world is not as big as people think. Everybody knows everybody. Like, you know, I go to these theological conferences whenever I can, or whenever I present a paper, I go. When I don't present a paper, I don't, you know, go. But I present a paper. Present a paper very often. I'll probably present a paper next year if the conference is open. They're all like closed down because of COVID. You know, same theologians come every year, like same 10,000 theologians, you know, a few are at it, few may die off, whatever. But, you know, they come every year, so you see them all the time. So after a while, you know everybody. It's a big, small family. It's a big family because they're all over the world teaching like theology in seminaries and universities. But, you know, they all come to the same conference every year, so everybody knows everybody. And people catch up and gossip and stuff like that, you know how it is in life. Yeah, the world is very, very small. Everybody knows everybody. Especially as you go higher, people know everybody, because like you may go to a theological meeting and you may be talking to a theologian Joe Garber's wife's brother's wife, so sister-in-law of Joe Garber's wife. And then you know, her husband is actually an Episcopalian priest, so I guess they run in the same circles. But you know, he could be like doctor, medical doctor, or he could be like a lawyer, right? So imagine like you meet like 50 theologians and you know them well. You eventually get to know the spouses well, and you may meet their children. And I've met children of theologians. They bring them to the conference, or other social events, and you may meet up. It's fun. And then you get to meet the spouses, spouse, and then you get to you find out like their spouse from another context, or your friend's spouse knows your another friend, So I'm sure like there are nurses at Virginia Hospital Center whose husband is like Episcopalian priest, or Lutheran pastor or Presbyterian pastor, theologian. There's everybody. You don't always marry someone. Like I'm a nurse now, but um, yeah, Virginia Hospital Center, end up marrying a nurse, right? Uh, but I may end up marrying someone else because I go to conference for Kappa Delta Pi, which is an international honor society for education. And they have conference once a year. I go to that, present papers. 'Cause I'm an expert of education, and I'm researching how to improve inner city public schools. I'm doing a doctorate on that right now, a doctorate of education. So I may end up marrying somebody from like Kappa Delta Pi, like International Honor Society meeting or another educational conference where I present my paper. I'm a like Leonardo da Vinci of 21st century. I have many different expertise, and I constantly keep up with the latest research in every field that I'm an expert in. So I go to theological conferences, Jewish studies conferences, present paper on the latest research. I'm a leader in every one of these areas. Um, and then now I'm going to be participating in nursing. I'm going to be doing a poster research for Virginia Hospital Center in 1 year residency program. Our cohort, we have a cohort. We present a paper or like a poster research that's based on evidence-based research, and I'm going to try to present that at a conference. Um, Maybe like a nursing international honor society nursing conference or another nursing conference. I'm probably going to do research that's specific to my unit, so I can help my unit improve. And that's what clinical nurse leaders do. So I'll research the latest techniques and successes and failures in my unit specific research and present it maybe at a nursing conference for my unit, like area. And so yeah, so I'm looking forward to that, and that will be like presented in I guess next August or September, 2021. Um, unless you vote me for U.S. Congress of Virginia's 8th District, then I'll go to U.S. Congress. But I'll probably still continue to research and present a poster research, just, but so if you vote for me for U.S. Congress of Virginia's 8th District, I go to get sworn in January, go to U.S. Congress. If not, I continue, my nursing work at Virginia Hospital Center. I'll probably do the research for my unit-specific evidence-based, whether I go to Congress or not. So I'll have research that I can present and then publish. There's one registered nurse right now in U.S. Congress. I don't know if she's going to win in November or not, but she's from Illinois, state of Illinois. She's an African American nurse. Underwood is her last name, from Illinois, and she came to Georgetown, invited by Georgetown University School of Nursing and Health Studies to at our big lecture, and she presented on something that's related with healthcare and healthcare policy. So if I go to Congress in January and she gets reelected, I think she's first term congresswoman. Then we can work together to probably on healthcare issues. Because I see eye to eye with her on many issues. Um, I think we can improve on Affordable Care Act. I think there's a lot of problems with it. So it may be a good idea to replace it and repeal and replace it. And so that's the position I'm taking, as you know. I don't like some of the problems that Affordable Care Act has. I kind of like President Trump's plan. I think it's a better plan. We take care of people with pre-existing conditions, but we need to control uh, pharmacy, like insulin costs that Affordable Care Act failed to do. I mean, Affordable Care Act has a section on diabetes, and I presented the section on diabetes to healthcare policy uh, master's level course seminar at Georgetown University, and it was an Affordable Care Act. Um, and it was like a group project. But you know, insulin price has been rising, and Affordable Care Act has been here since President Obama. So I see the failure to control the high cost of insulin as a failure of Affordable Care Act, ACA. You see what I'm saying? You cannot separate things. When you have Affordable Care Act uh, as a law of the land, and insulin prices keep going up. So that insulin price in America is like 100 times more expensive than other countries. You have to be honest with yourself and say, what's so problematic about Affordable Care Act, ACA, or Obamacare, that insulin prices keep rising every year? And after many years of Obamacare, Affordable Care Act, insulin prices like 100 times, same insulin costs 100 times more in America, so that you have American citizens sharing insulin or skipping insulin doses. You know, Americans, there are a lot of Americans with diabetes who need insulin. Some could die if they don't have enough insulin. I'm sure many Americans die because they can't afford the insulin. So when we're talking about healthcare, we cannot ignore the fact that insulin prices have been rising under Obamacare because Obamacare is the law of the land. President Trump doesn't like Obamacare. Republicans try to repeal Obamacare, but they failed to repeal it, and maybe that's the problem. We need to get rid of Obamacare as a way to solve the problem of rising drug prices. Because you cannot say, oh, Obamacare is the law of the land, drug prices are rising and they're not related. You can't say that. Everything is related in politics, everything is related in policy, right? There's something seriously wrong about Obamacare, and that is why drug prices are rising, right? So we need to fix that. My argument is we can't fix it with Affordable Care Act still in place. So that's just one problem with Obamacare that I have a serious problem with. And that's why I would encourage all of you to vote against Obamacare, Affordable Care Act, because it is a highly problematic healthcare system that has caused a lot of problems, including rising drug costs. President Trump, has tried to decrease drug prices by executive orders, and um, President Obama didn't even try, to reduce. So I feel like Obama might have bought a lot of stocks in pharmaceutical companies. I mean, I don't know his stock portfolio, but I'm just, guessing here. And that's why he didn't try to reduce the drug prices because he knew it's like insider trading, but not really. You could anticipate certain things, right? If there's a World War III, stock market may go down. Certain things you could anticipate. So Barack Obama may have bought a lot of stocks in pharmaceutical companies, and he knew that if he issued an executive order uh, against rising drug prices, drug pharmacy companies may have stocks go down. And maybe that's why he didn't do it. Like, there's like alternative motives for every human being. And that's why I don't like the Affordable Care Act. I never liked it because I've been following it since the very beginning. And then you see the drug prices rising. And Affordable Care Act, ACA, is the law of the land. There's a problem. Um, and Affordable Care Act has been seriously problematic in raising private health insurance costs as well. So Affordable Care Act has to go. I mean, you've seen how much your insurance prices are going up, right? And if you're working and your workplace partially pays for your insurance, you've seen your premiums rise in the last 8 years. That's because of Affordable Care Act. That's the single problem why your insurance premiums are rising. It's not a sustainable program for America because everybody who's working, some people have to pay like hundreds of dollars. Some are paying over 1,000 a month while they're working and their employer provides them with health care. That's not right, And that Affordable Care Act is hurting private insurances as well. So you have to get rid of it and we have to replace with something more effective. Any kind of a second version 2.0 is going to be better, right? So I'm 100% sure whatever President Trump comes up will be better than Affordable Care Act. And let him have his shot at it if he gets reelected. Because Affordable Care Act hasn't been working for the past like 8 years. There's no reason to keep it around, you know? Um, and if President Trump's healthcare system project fails, then replace it and replace it with another one that works. You don't have to be on a sinking ship. An Affordable Care Act is a sinking ship. And so, you know, uh, I don't want you to be slowed out from, as much as we uh, We love building a snowman. I don't want it to be built, built out of your healthcare, or scrounge for food and rent and things that you need, like vacations you want to take, uh, gifts you want to get for your children because you have to pay monthly, like high premium on your employer provided insurance. That's not right. So we're not just talking about Affordable Care Act itself, but its ripple effect or its domino effect in what it does, to private insurance holders throughout America, private insurance they have through work. Um, and if you get paycheck and you see a large chunk taken out of your paycheck for insurance, right? And it gets higher and higher, and I mean, it's going to continue at the same rate with Affordable Care Act. Now, can you handle that? So, can I get a five on repealing or abolishing Affordable Care Act? We need to get rid of Affordable Care Act. And that's good for all the Democrats. That's good for all the Republicans. That's good for all the independents. As you know, I'm an independent candidate for U.S. Congress of Virginia's 8th District, and I just want the best for you. That's why I'm asking for a five on repealing Obamacare, because we need to bring insulin costs down. We can't do it with Obamacare. I mean, just read the diabetes portion of Obamacare. It doesn't have anything about reducing insulin costs. Certainly, it hasn't really done anything to actually reduce the cost. So there's two, right? You have a theory. You could talk until you're blue in the face about reducing insulin costs, and you may make that your policy, but if that's a theory. But if the actual insulin costs don't go down, then what good is the policy? Policy has to translate into action, right? You actually have to see your insulin costs go down. You see what I'm saying? I mean, Obamacare could have made it so that 100% of insulin is covered by Obamacare, but Obama did not do that, right? I mean, Obamacare has to go because this is not just about insulin. It's about all types of treatments. Drug prices are too high. I mean, the same drug in Africa is so much cheaper. Same drug in Asia is so much cheaper. It's not right that you as Americans may have to die because you can't afford the drugs, whereas Asians and Africans and Europeans can afford the same drug and they don't have to die. Right? It's not fair for you. That's why I said give me a five on repealing Obamacare. Vote against Democrats. I mean, in Virginia State District, I encourage you to vote for me, Heerak Christian Kim, independent candidate for U.S. Congress of Virginia State District. I'll get this fixed for you. So you don't have to pay. I mean, I think insulin should be paid for by insurance. That's my, because diabetics would die without insulin. So there's certain medications that should be like free for people who are on government insurance plans at any level, because Obama plan is like has different tiers, um, and so and I personally think that insurance should be free for private insurance holders as well, because if you're working and you can buy insurance every month, and insulin cost is that high, you can't buy the medication you need to live. That's not right. And so that's why I have to say I agree with President Trump on healthcare system. We need to get rid of Affordable Care Act because it's not affordable. That's the problem, right? If Affordable Care Act is affordable for everyday Americans, working class Americans, I would support it. There's no reason for me to oppose Affordable Care Act if your insulin is free, right? And working class Americans who may make money, but they are just living paycheck to paycheck, if you can pay for your insulin every month without any problem. And as I said, I want insulin to be free for all Americans who have diabetes who have to take insulin. Because you'll die without insulin. You know, um, and we're talking about, something like food. Insulin for diabetics who are on insulin is like food. You're gonna die without insulin. It's literally like food, literally, because when you eat the food and you don't have enough insulin, food doesn't go into your body, right? The I mean, for your nutrition to go into your body, your sugar to go into your body, your cells, you need insulin. So it is technically like a food. So insulin should be free. And I think President Trump has a better idea of what Americans need. And maybe it's because he's a businessman. He understands like what people want and what people need. And so when he talks about pharmacy, pharmaceutical companies, when he talks about insulin prices, it makes a lot of sense. I'm sure all the Democrats and Republicans out there are agreeing with you on that point. Affordable Care Act has to go. It's like the evil of America. I see Affordable Care Act as the most greatest evil legislation passed by U.S. Congress. It is evil because it raises insurance premiums for 100% of Americans. Even people with Affordable Care Act has to pay high premium because if you're in Affordable Care Act, you know what I'm talking about. Let's say you work 3 jobs and you have to get insurance renewal, so you go through insurance through Affordable Care Act. Your insurance cost is sky high. You're like it's a burden that's like weighing on your shoulder, right? You have to worry about paying insurance premiums every month if you have 2, 3 jobs and you have to go through Affordable Care Act. You know what I'm saying? That's why you need to vote against the Democratic Party because they're going to continue this nightmare of Obamacare, which is the most evil thing in the world. And I was disappointed for about Judge Amy Coney Barrett. She should have been more brave. She's like, oh, I'm not really opposed to Affordable Care. I'm like, geez, you I mean, I don't know. I was disappointed by what she said about Affordable Care Act. I think she should have come out and said there's a problem with Affordable Care Act. But I guess she's in a confirmation hearing, so she has to kind of try to please everybody. But no, Affordable Care Act, it's an evil system. Um, you know, um, that keeps raising insurance for 100% of Americans. People on Obamacare, people not on Obamacare. It creates larger problems for uninsured people. Um, it's a problem for everybody. It's a problem from everybody. I think United States would have been better without Obamacare. Obviously, they could have just passed one law saying all insurance companies must cover pre-existing conditions. You didn't need Obamacare to do that. And we would have been in a far better situation with just one legislation, with one issue. Every insurance company must cover pre-existing conditions. That's all they needed to do. They didn't have to go through this mumbo jumbo, big, hundreds of pages document, Affordable Care Act, ACA, Obamacare, and then ruin America's healthcare system. Most doctors hate it. Most nurses hate Affordable Care Act. There are 4 million nurses. I mean, some people like it, but majority of nurses don't like it because they have friends who talk about not being able to afford insulin, and they're not dumb. They understand that there's a correlation between rising insulin costs and Affordable Care Act, which is the law of the land, for the past 8+ years. I mean, this is not an accident. Everything is related. So a majority of nurses, a majority of doctors are against Affordable Care Act. Professional organizations are made up of a few people at the top. What they say doesn't represent everybody, Yeah, I mean, most nurses don't join American Nursing Association, ANA. During our nurse residency program, our chief educator asked us who's a part of ANA, American Nursing Association, and there's I guess 15 or 17 of us who are registered nurses, new nurses at Virginia Hospital Center. And there's one person who raised her hand. None of us raised our hand, and none of us are planning to, many of us are not planning to join American Nurses Association. So whatever an American Nurses Association says about Affordable Care Act or ACA or Obamacare, majority of nurses are not going to agree with that, I mean, I didn't do a survey of all my fellow RN nurse residents in my cohort at Virginia Hospital Center. We have a cohort for every RN nurse residents who come in. There's a next cohort is going to be coming, I think, in January. So from my cohort to January cohort, there's no new nurse graduates being hired because new nurse graduates have to go through this cohort system. Because every hospital has this training system for new nurses. So we're in that training system for 1 year. And it starts with a cohort. So my cohort started, and the next cohort is in January. So there's going to be several months with no new nurse residents being hired on at Virginia Hospital Center. So the next nurses, each cohort is like anywhere from like I guess around 10 people or more, give and take, or less. My cohort I was told was one of the largest ones. Um, I think we have like 15 or 17, like 15 to 17. But yeah, so yeah, so things are looking bad for America, and there are 4 million nurses, and majority of the 4 million nurses are not members of the American Nursing Association, which is a shame. I mean, maybe I'll join because I like being part of professional organization. There are more than one nursing professional organization, and when I was a student, they give a free membership, but not American Nursing Association, but Oncology Nursing. So I was a member of the Oncology Nursing Society (ONS) for 2 years while I was in nursing school. I went to their meetings when I could. But like the free membership expired when I graduated from Georgetown University in August 2020. I mean, I may still join Oncology Nursing Society, but the membership fee is really high. I don't know. Uh, my unit is not oncology nursing unit. I have a friend in my RN residency who's in oncology unit. I'm sure she'll join ONS Oncology Nursing Society. But since I'm not in an oncology unit, I don't know. I mean, I want to excel my unit, and so yeah. So I mean, I don't think I will join oncology nursing unless in the future, unless they offer free membership when I join. But unless in the future I do something with oncology nursing, and I'm thinking about doing that maybe for my doctorate in nursing. That's like ways off. If I do continue, because I want to research heart attack, out of hospital cardiac arrest, hospital attacks outside of the hospital in cancer patients. So that's like research I want to do for my PhD in nursing. I'm thinking about maybe Johns Hopkins for PhD in nursing. It's 100% online. Um, but and Georgetown University is in the process of developing PhD nursing. So if that comes into place when I'm applying, maybe I'll do it at Georgetown because I know the professors there. So I'll probably work with Professor Kelly Anderson, who's in charge of starting the PhD program in nursing at Georgetown. So maybe I'll be like the first PhD student, to graduate from Georgetown nursing PhD program. So I would probably have Professor Kelly Anderson, who's like probably the director of the PhD program. He's in the process of putting the paperwork to get the program finalized. And I think paperwork's are away, and it's about like bureaucratic stuff that they have to just create the program, and it takes time, I guess. And then I'll probably have Jane Paul Dixon. She's the oncology nurse, researcher at Georgetown University Nursing School. And I've talked to her about doing PhD nursing with her, on oncology. And if we have a PhD in nursing, I could do it with her through the PhD program. Maybe have Professor Kelly Anderson for the cardiac side, Professor Jane Paul Dixon, who taught for the longest time at National Institute of Health. I mean, she was a researcher there on oncology, and she taught at Georgetown for a long time. So those would be my two like co-chairs for oncology nursing PhD if I go through Georgetown. I'll probably go to a place that will give me free scholarship. But Georgetown is close by, it's like 5 miles from here. That's where I did my master's in clinical nurse leader, 2 year full-time nursing program, and graduated in August. And I graduated with 25, 24, because including myself, there's 25 of us who graduated in August. And yeah, so yeah, CNL 2020, Georgetown University, yay, we graduated, yay. Are you excited about graduating? Although a lot of people are taking RN exam now. I took my RN exam like on August 31st. Our official graduation day was August 24th. So I think like one week after our official graduation day, and I passed, yes. I'm very good, in nursing, so I'm not surprised. But it shocked the nursing department because I don't think anybody took it. I think I'm the one who took it earliest in the history of Georgetown University School of Nursing, both for BSN programs and master's programs. in nursing. Like nobody takes it like a week later, you know. And I did, but I'm very good at what I do. I'm a very good nurse. So Virginia Hospital Center is very lucky to have you. But COVID-19 is hitting. Um, yeah, and I'm working at Virginia Hospital Center, and many of us are working at different hospitals in this area. Some people have decided to wait until they take the RN exam and pass to apply to jobs. So you know about Fairfax, I guess, is recruiting for next set of nurse residents. I guess their nurse residency program will start in January as well. So they're recruiting. So I guess they're recruiting among Georgetown University CNL graduates from August who haven't applied yet to any nursing schools. Um, Hopefully, some of them will come to Virginia Hospital Center for our January cohort. Hey guys, apply to Virginia Hospital Center. You guys will love it. You guys will absolutely love it. I can say with 100% confidence. It's like out of all the hospitals we worked at, it's like my favorite. I'm telling you, you guys will love Virginia Hospital Center. So, yeah, so apply to the January cohort. Um, I know some of you are waiting for the Georgetown MedStar cohort, which starts in January. Like there are two cohorts at MedStar Georgetown Hospital, which is middle of July. So Georgetown clinical nurse leader master students can apply for that because we graduated in August. Um, and then there's a January cohort, and I know some of you are thinking about going to MedStar Georgetown. And MedStar Georgetown Hospital is great. But I would say, Virginia Hospital Center, I think you will enjoy working at Virginia Hospital Center far more. I mean, that's my personal opinion, obviously, and I'm sure, I love working at MedStar Georgetown Hospital. So it's one of my fondest memories. I worked at orthopedic unit at Georgetown MedStar Hospital. And my clinical instructor was amazing, Siobhan, Professor Siobhan Musler Mahoney. She was, at Georgetown orthopedics unit for 2 decades. She went to University of Fairfield in Connecticut for Bachelor's of Science in Nursing. And then I think she might have come directly to Georgetown MedStar Hospital, or she might have come soon after that. But she's a great, amazing nurse. She's an amazing clinical professor. Um, yeah, she's incredible. She wrote recommendations for me, and she's nice. She's wonderful. And I was originally planning to go to Georgetown MedStar Orthopedics unit, uh, the MedSurg unit that my clinical instructor Siobhan Messler or Siobhan Mahoney is in has been in for like a couple decades. Um, because I loved working there. I was very good at it. I had like over 95% on my you know uh, 15 page nursing care plans. 15 pages. Jesus, took me like 10 hours minimum to work on those nursing plans. I've put a lot of time into it, researched, evidence-based research. Obviously, all my five nursing care plan were on orthopedic patients, you know, uh, a spine injury, spinal fusion surgery, hip replacement surgery, knee replacement surgery, um, diabetic amputations of toes or, feet or foot. Um, Things like that. So I did five nursing care plan. And I like average of like I think it was like average of 97% on all my five or something like that. On my all my care nursing care plan. I mean, I like aced that. I mean, I was so good in the orthopedics unit at MedStar Georgetown Hospital. So I was originally planning to apply to that, but I found out the cohort only admits in July and January. So clinical nurse leaders graduate in August. So those who want to go to the cohort for new RN residents, new nurse grad residents, they have to go to the January one. And I'm like, I'm not gonna wait until January. Life is passing you by, you know. It's not like I'm getting any younger. Like, why do you think I took my NCLEX RN exam 1 week after my official graduation? That I mean, our courses were over like August 7th, official end date for all of our courses. But you know, graduation is always several weeks after the finish of the semester, right? End of the semester. So I did have more than 1 week to study for it because I started studying like, you know, kind of concentrated studying after, you know, end of the courses. I guess it was on August 6th to August 31st. But you know, our official graduation day was August 24th, 2020. So it was 1 week after our official graduation date that I took my NCLEX RN. So I broke the record at Georgetown University School of Nursing Health Studies. So my name will be remembered forever among all the professors of nursing at Georgetown as someone who passed their NCLEX RN exam the fastest. And I dare anybody to break my record. I mean, um, yeah, for future cohorts. But yeah, so Billy, the Naval Academy officer, he's still active duty, and he's in like he served as a commander in U.S. Navy for like 20 years, and he went to U.S. Naval Academy. He's a brilliant guy. He's from Texas. He has a family farm in Texas. Can you believe that? Cows, and I don't know what they grow there, but I should ask. I think he might have shared it with us sometime. That I think they grow stuff and they have animals. That's what farms are, right? But anyway, yeah, he's a great guy. And so yeah, so he took NCLEX RN yesterday, and he tweeted this morning, early this morning, Betsy, Betsy, one of our core members, she's like one of the oldest cohort members in my cohort, clinical mosquito 2020 cohort, and she was, kind of saying that she's confident that Billy passed. Billy and I and Grant, three of us are the only males out of 25 graduates. And Billy like tweeted later, like say, he feels like he passed. I'm sure he passed. And I guess he called it the ghetto indicator. Like if like the way that NCLEX RN exam starts is or if if the exam shuts down early, then either it's clear that you passed or it's clear that you failed. That's why the exam shuts down early. So exam can shut down early, like after like I guess Billy was saying 75 questions. Um, my exam shut down early too, but I took it during COVID-19 period. So until end of September, the exam was a different format because of COVID-19. And then I think from October they started, they went back to the old format. They're all difficult. I would say it's easier to flunk with fewer questions. you know, um, I don't know. But I passed, so I'm not going to worry about it. But um, because as I said, George Washington University Nursing School, cohort 2020, two people flunked in the shorter COVID-19 version. So I think that may actually be harder. I think generally no one flunks in George Washington nursing program. But it could also be because of COVID-19, because you can't study in a library or in a cafe. So I think there are several factors there. But yeah, I guess the exam shuts down after 75 questions for people who are clearly passing or people who are clearly failing. And for those nursing students who are like in the borderline, they could fail, they could pass, the question continues up to like I guess 400 or something. Don't quote me on that. Um, Billy was referring to his exam shutting down at 75 as like the ghetto way of knowing, meaning like there's no official record saying that you pass or even unofficial record saying you pass. It's just that's like the kind of the way nursing students are like, oh, exam shut down early, so I must have passed. But so RN resident at Virginia Hospital Center was sharing with me about her fellow George Washington nursing students who graduated in 2020. She said one of her friends who failed, her exam shut down early. And so she was so excited that she passed, and then she found out 48 hours later to get her own official result that she had failed. So she was shocked because, in the nursing world, the idea is like if the exam shuts down early, then you pass. So Billy is referring to that as a ghetto way of knowing, because it's not official, it's not unofficial, it's just kind of like, kind of, hearsay, what nurses tell each other, like if you exempt us early, you probably pass. And that's what we talked about at Georgetown too. But I mean, I guess, I was rereading the fine print. And they said if your exam shuts down early, and this was like on a nursing chat page, I think it was. I don't think it was on the official page. It says if it shuts down early, then it might have been in the official Pearson page. I don't know. I mean, it's been a while since I had to look at all the Pearson stuff. This was like before August 31st. I was like, trying to look at all the backgrounds. But now I'm like, yeah, that's like in the past. I'm now a registered nurse, so I'm like trying to clear out my memory area in my brain. But anyway, yeah. So when exam shuts down early, it could mean that you flunked. Apparently, and I read that at summer, and George Washington University RN resident who's at Georgetown, she passed hers. Um, so her friend exam shut down early, but she flunked. So, and if you flunk any RN residency job you have, it's gone. Like you get immediately terminated. So I think that's what happened to her friend. Because you can start as an RN nurse with an authorizing to test, but if you flunk the exam, you're immediately fired. Like the moment that you find out you failed. Um, so I mean, it may happen to a lot of people in COVID-19 America. Because NCLEX RN exam is going to keep the standard up, and it makes it hard, even during COVID-19. Or they might have made the COVID-19 version harder. Because they know that nurses have to, you know, do a lot, risk their life and stuff like that. So who knows? They say it's the same difficulty level, but I don't know. I mean, but the exam was harder than the practice one. Uh, I thought everyone who took it, kind of share with me that they thought it was kind of hard. But Billy's brilliant, so I'm sure he passed. But there may be others who may not. Um, yeah, hopefully nobody in our cohort. But, yeah, so Fairfax is recruiting for, I guess, their January cohort. I guess Georgetown University MedStar Hospital will probably recruit graduates from my cohort for MedStar cohort. Uh, to be honest with you, after doing the research, Billy was our leader for clinical nurse leader capstone project. So as a group, we talked with chief nursing officer at Georgetown and I guess chief research officer or whatever, two top nursing people at Georgetown, and we came up with recommendations on how to improve the RN residency program. And to be honest with you, I didn't really like what they said. I'll tell you, I mean, none of us really liked it. None of us in our group. And Billy also didn't like it. If I remember correctly, we're talking about it. I mean, some people went back and forth between different ideas, but one of the things that we really did not like about Georgetown MedStar RN residency program during COVID-19, because they shared with us, and it's not like secret because our capstone project is public. If you want a copy of it, I'll be happy to send it to you. It's not like a secret. It's a capstone project, which by definition is a public thing. Um, you know, uh, any kind of final project at a university it's public domain. So I mean, I have no problem sharing this because it's all in our capstone project, which is in public domain. Um, so one of the things that we did not like about RN residency program at MedStar, and obviously there are different groups of ours who did their capstone project with the RN residency program at Fairfax Hospital. There are others who did it with other hospitals in the area. So I'm just going to talk about mine. Um, What I didn't like about MedStar Georgetown Hospital uh, RN residency program is that they said during height of COVID, um, they have to like there were times where the preceptor had to go float to another unit, like to like a COVID unit, I guess, and they made the new RN nurse residents float with the preceptors who are experienced nurses. Some of them, like my preceptor at Virginia Hospital, said he's amazing. He's been at the hospital for what, over 10 years in the same unit, doing the same shift for over 10 years. Like I think it was like 13 years that he worked in the same unit, same shift for 13 years. He's an expert, right? But I mean, he's worked in other units too. But I mean, when chief nursing officer at Georgetown RN residence program said they floated their RN residents with the preceptors when they floated, I was like, what the hey? What the hey? Because you're talking about new graduate RN nurses, right? And generally, the way the RN residency program works is you go into a new hospital for 1 year, you work in the same unit because you're like brand new, you're brand spanking new. I mean, you're gonna make mistakes, and they expect you to make mistakes. There's no point about having an RN residency program. If you don't make mistakes, then you should not be in an RN residency program. Because the RN residency program has preceptors, and it's 1 year long to make sure that you have support system when you make mistakes. That's no point, right? So throughout the country, when you go to this RN residency program, some RN residency programs are longer than a year, but mostly they're 1 year. Um, you are in the same unit for the whole year. The point is, you make the errors, you learn the system, you learn the kind of patients that you get in your unit, and you make less mistakes, you become more efficient, you become better. That's the whole point, right? Because you're a novice nurse. You just got your RN license, you're brand new. So you're in that unit for 1 year, making mistakes throughout the year. Today, I worked a 7 p.m. to 7 a.m. shift last night at Virginia Hospital Center, and I handed off my, we hand off to the nurse who's going to be from 7 a.m. to 7 p.m. shift. So I handed off to a nurse who started her RN residency program, I guess, in April 2020. Can you imagine starting an RN residency program in April? But I mean, we didn't have it that bad here. It was New York, it was bad. So, here it was like negligible. You didn't even notice. But so I talked to her, and she said she's still learning the trade. And I guess it was Wednesday. She was saying she was charting until 10 p.m. Like, she finished her shift at 7, and nurses, we document, right? So she went from 7 p.m. to 8 p.m., 9 p.m., 10 p.m., 8, 9, 10, 3 hours. She had to stay behind after her shift to put all the documentation in because, things are really busy, and experienced nurses do that too. But she was saying that as a new nurse, she started in April, you know, uh, she's finding that she has more, she needs more time. And that makes sense, I mean, you become faster and everything, more efficient and everything, making less mistakes as you get better and better. She just started in April. She just got her RN license, like, um, shortly before April. So, so I handed off to her. So I handed my patients off to her, and then yeah, and she was telling me like her RN residency program goes for 1 year. So she's in RN residency cohort that she's in until next, I guess, April. So she's in this RN residency program. So she's in my cohort. Oh, no, she's not in my cohort. She's in an earlier cohort, but she's in my unit as a new nurse resident until next April 2021. So she only works in my unit for 1 year. Um, and that's how it is in every hospital. But through COVID-19, some hospitals are like, because hospitals can get inundated with COVID-19 patients. And I guess they have to like shift around nurses because sometimes nurses get COVID-19 and they can't show up. So there's like gross shortage of nurses, and that's going to happen in the next 6 months of flu season. Um, you know, every hospital in this area is already experiencing shortage of nurses. You know, um, and so they're calling people coming for an extra shift because some nurses are getting COVID, right? Or some nurses were exposed to people who have COVID and they're, self-isolating for 14 days or whatever. So there's shortage of nurses in every hospital in this area right now. So they're calling people who don't have COVID or were not exposed to COVID patients to come in for extra shifts. So that's already happening in October. So you can imagine what's going to happen in November, December, January, February, March, April, 6 months. Yeah. I mean, there's going to be nurses dying. And I'm saying like 12 nurses will die in every hospital minimum by Christmas because COVID-19 kills. It's just logical sense, right? It's science. You can't escape science. So if 12 nurses die, there's going to be people who's going to, other nurses who might have been exposed to those nurses who may have to self-quarantine or who may get COVID as well. They can learn while they have COVID, right? So can you imagine the shortage? Some hospitals will have like 100 nurses less. Can you imagine how you're going to fill 100 nurse shortage? Like if you have 100 nurses out, either with COVID or like COVID exposure, how are you going to fill that gap? Think about it. And this is like for October, November, December, January, February, March, April, May. You have 8 months of this problem potentially coming. 8 months. Flu season maybe 6 months, but until May, things are not going to settle down because we know that because we've seen it. Like COVID-19 was here proliferating until May. And then it starts dying down, and then in June it starts picking up again, right? So until May, hospitals are going to see problems, serious problems. Um, so let's say 100 nurses are out, either dead or suffering from COVID or self-isolating. 100 nurses in one hospital. How are you going to fill that gap? So, like they had the same kind of problem, although a lot of nurses that died because our first peak started like basically in March, and we didn't really start seeing any death till like April. If you go to my first episode, April 2nd, 2020 was my first episode. There were like 7,000 people dead from COVID in America, all over America. So I mean, you're not going to have many nurses dead in April 2nd, right? When there's only 7,000 people dead in all of America. Now 1,000 people are dying per day. That's like 1 week. So this flu season is going to be different. We're going to have minimum 10,000 nurses die by Christmas. That's what I'm saying, registered nurses. I'm not even counting like Mike's wife, profession, like occupational therapists, physical therapists. Many of them are going to die. Respiratory therapists, doctors, physicians, surgeons. I'm not counting any of them, anesthesiologists. I'm sure many of them will die too. But I'm talking about nurses. We're going to have minimum 10,000 nurses by Christmas. Why do you think I have a Christmas show? In case you die before Christmas, I want you to enjoy Christmas as much as you can before you die. Yeah, so it's, yeah, it's going to be horrific. I'm saying minimum 5 from my cohort of 25 CNL 2020 will die from Georgetown University. 5, and there are people who have asthma, there are people who have other conditions, and they're going to die, It's sad, but nursing is the most dangerous job in America right now. Nursing is the most dangerous job. There's no job more dangerous than nursing right now. This is COVID-19 era. 1,000 people are dying every day. Nursing is the most dangerous job. So if you're a nurse working in a hospital, you should expect to die, right? I mean, you may not die, but you can. So I wanted to cheer for my clinical nurse leader program members. CNL 2020, Georgetown University, yay! You may die before Christmas, but you can put on your tombstone, Georgetown CNL 2020, yay! Well, not everybody can put RM there because not everybody has taken NCLEX RM yet. and some of you, may flunk. I mean, I hope you don't. I hope nobody flunks, but you may flunk. You have to take it again a second time. You may flunk a second time. We don't know. Um, people flunk two, three, four times. Before passing some of them. So. There's no library, and some people cannot study outside of library. So if you're one of these people, you may flunk two, three times. We don't know. Um, yeah. So yeah. Hopefully none of us are like that, but you never know, right? Um, so yeah. I mean, but so not everybody can put RN after their name and their tombstone if you haven't passed twice RN. But at least you can say, Georgetown University 2020 CNL cohort. If you didn't pass the CNL exam, I'm sure everybody's going to pass, hopefully. But if technically you can't even put CNL after your name. But that exam's like $500 to take. I passed. I took it on the first available possible exam date in July. I think it was in July. Excuse me. The first day that exam opened, the exam period is like for several weeks. I took it, I passed. Yes. I'm a very good nurse. My gosh, you're not gonna find people like me in the nursing world. Like, oh geez, I'm gonna be doing great things in the nursing world. So Virginia Hospital Center is very lucky, to have me there. But I hope my fellow clinical nurse leader, who 2020 core members who haven't applied for jobs yet will apply for Virginia Hospital Center cohort in January. You'll love it here. That's my opinion. Um, the nurse educator, Debbie, she's great. She's like the chief nurse educator for us. All right, she's great. You're gonna love Debbie. She's like so nice. Yeah, so she'll be your leader as well in January. Um, that's the next cohort. There's no cohort from now to January. And I guess Innova Fairfax cohort will start in January. But yeah, going back to Georgetown MedStar Hospital, the reason like I had problem and many of my group members had problem was they floated our RN residents with their preceptors. And I'm like, what? What? These are new novice nurses. They're brand spanking new nurses. And you're gonna float them to different units when they're trying to get used to their units? I'm like, what the heck, man? I mean, that's ridiculous. I mean, that's what I was thinking. I didn't say it like that to my core members. I mean, we kept it professional and, we're discussing in like objective terms, you know. But well, actually, we were a little bit informal because we're like friends. We like feel like family after 2 years of hell program from hell. No, no, it's a great program. I mean, it's hard though. So suffering bonded us. Well, 25 us. Even people who hate each other, they feel like they're family because because there have been like fights among core members, like verbally, like yelling at each other in front of other core members or something. I mean, there's a lot of stress and people get like, I'm like, whoa. But yeah. So anyway, I guess they'll be like that in hospitals during COVID-19. When you have 100 RN nurses out, either because they die from COVID or because they're sick from COVID or whatever, I bet, some nurses will have, very sensitive nerves at that time. I guess we're looking forward to that in January, maybe even December and as early as November, even October. Who knows? Um, but yeah, it's gonna be hell in hospitals for nurses for the next 6 months, the next 8 months. It's gonna be like, I mean, right now, I'm just learning, but I'm talking about, at the height of flu season, I bet everybody's gonna be like stressed out to the max. Yeah, but so the chief nursing officer made it sound like it was a good thing. I mean, that just puzzled all of us. She's like, yeah, when the RN nurse, preceptor for RN nurse residents floated, we floated the RN residents with the preceptors. I'm like, what? Oh man, that's just that's. I mean, because new RN nurses have to get used to COVID-19, right? It's not like they've been in the nursing world all this time, right? So they're getting used to like COVID-19. Like they're not like nurses who've been in nursing units for 10 years. it's like second home to them, and they just have to get used to COVID-19, right? Um, and then right? And then it's a completely new environment. It's like being a nursing student is completely different from being a new nurse, right? Being a nursing student, you like spend 80% of the time like in your studies, books, reading or in lectures, or seminars, right? And you have these clinicals where you learn under like a clinical instructor, right? Um, you know, and so and then um, and then you have like completely new unit where you have to learn the unit specific skills for that hospital with their hospital's policies, which may be different from other hospitals. You have to reorient yourself to critical figures, which are different from hospital to hospital. I mean, they're similar, but and their priorities, hospitals have different priorities, it's different, and so you gotta, I mean, this is a learning curve. So it makes sense for 1 year, RN residents are allowed to make mistakes inside a bubble, right? You can't like treat new RN nurses like experienced nurses. That just wouldn't be fair, right? And that's why RN nurse residency program is there to kind of provide a bubble, you know, protective bubble for new nurses who just graduate from nursing school. So when chief nursing officer at MedStar Georgetown University Hospital said, like, MedStar Georgetown University Hospital as a policy floated their RN nurse residents to other units, like I guess including COVID units, when their preceptor floated. Um, I mean, some of them were like a couple of weeks out of their, a couple of weeks into RN residency programs or whatever. Or I mean, I guess their RN residency program started January, but I think they did not start. I guess maybe it was end of January, and then they said they held off for 1 month because of COVID, and then people came in. Some decided to not come, I guess, but anyway, so some of the people were just like a few weeks into the residency program, they're floating with their nurse residents, our nurse preceptors. Can you imagine how unsettling that could be? So we were like, my gosh, so we didn't want to be too harsh, but I mean, we felt like that was a little too much. So we came up with a solution. We say, you're gonna be like unsettling our residents, because of COVID. The least you could do is give hazard pay to new nurse residents. So we recommended hazard pay for MedStar Georgetown University Hospital new nursing residency program, like a separate, it doesn't have to be much, but like something added on base pay, hazard pay. And we actually recommended to all RN nurses. People were like, well, why don't you just make it just for RN residents, right? So all nurses are kind of risking their lives working with COVID patients. So we say, have hazard pay for all nurses. So that was one of our recommendations. But I have to be honest with you, when the chief nursing officer, I think she's an administrator, and she's an experienced nurse, so she may not be able to see it from our perspective. And that's why we do these capstone projects with chief nursing officers of major hospitals in the area, so that they can see our perspective, right? That's the whole point. So obviously we're going to be honest with them about it so they can improve their own residency program. So as experienced nurses, they can't see from the perspective of new nurses, right? They're not new nurses, they're experienced nurses. You can only see through your lens, you cannot see through the lens of others, right? Right? If you never went through bankruptcy, you're not going to know how it feels to be bankrupt. You can imagine it, you can try to be sympathetic or empathetic to it, but you can never be. If you never had like your leg amputated, you're never going to know how it feels to have your leg amputated. You can try to imagine, you can try to be empathetic or sympathetic, but you can never know exactly how it feels, right? Even if you're married to a husband who has an amputated leg, as a U.S. veteran, you're not going to fully understand what that means. And so, that's why we have these capstone projects. And Georgetown University is basically providing free consulting services to area chief nursing officers, right? Because if they had to go through like, what do you call that, McKinsey consulting firm, or one of these consulting firms, they would have to pay like hundreds of thousands or millions even maybe. Um, so that was one of our proposals, and that was a strike against MedStar Georgetown Hospital. I have to be honest with you. If you're going to float RN resident nurses, from the unit to another unit when they're supposed to be in the same unit for 1 year, that's just, unless, I mean, unless they signed up for it. But we're talking about RN residents who were signed on to one unit. That's the unit they want to be in. Just floating them just seems not a nice thing to do. Because you could float experienced nurses, but like new nurses, it doesn't seem right to do that. That's how, that's how all of us, like, that's the direction that our discussion was going. Um, yeah, and one thing I like about Virginia Hospital Center is, um, as far as I know, they don't do that. I know for my unit, we don't float. If you're like, our, you know, so yeah, they were going to float my preceptor to another unit. When I was in, a 7 p.m. to 7 a.m. shift, and it was his turn to float. I guess they have like, they go around. There's like a turn to float. So they were going to float him to another unit because it was his turn to float to another unit. But they say, well, we're not going to float you because you have you're precepting on URN resident, right? So I'm like, yes, I came to the right hospital. Can you imagine if I went to like MedStar Georgetown Hospital and they floated me with my preceptor? Geez, that'd be unsettling. That's like, I would hate that. I don't want to float to another unit, but I'm trying to learn my unit. You know what I'm saying? Doesn't make sense. That you float like a new nurse to a different unit. Yeah, it doesn't make sense. It's ridiculous. Uh, so, uh, so after the chief nursing officer said that, I was like, man, MedStar Georgetown is like out. Uh, during COVID-19 era, especially. They don't float anybody during regular residency, during non-COVID-19 season. They just keep you in the same unit, right? It's just, it's their emergency measure. But I think you need to understand that new nurse residents are new nurse residents. They're in the training program, right? You can't forget that, right? You can't say we're going to treat new nurse residents like our experienced nurses. That doesn't make sense. And that's an idiotic way to go. Sorry to use strong words, but all of us were like talking in this kind of direction, floating new nurses to other units, COVID units. I'm like, whoa. If patients come into unit with COVID, that's different, right? But floating you specifically to like a unit with your preceptor who's like 10 years experience or whatever, it doesn't seem to make sense, But anyway, that's when I said like MedStar Georgetown University Hospital is like out, It's like out, 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 So if you don't mind floating, yeah, apply to MedStar Georgetown Hospital. Maybe they changed the policy on that. You could ask. I would imagine you could ask. I don't know. I didn't ask about that in hospitals that I applied to be honest with you. But it is a testimony to how well Virginia Hospital Center treats you, right? Yeah, if you hire somebody onto your unit as an RN resident, you keep that person in your unit for 1 year. It's a training period, right? It's like, doesn't that make sense to you? So that's why I give 2 thumbs up to Virginia Hospital Center. And I hope all of you who haven't applied for jobs come to Virginia Hospital Center for January 4th. It's a great hospital to work for. People are really nice. You're gonna love Debbie, the chief nurse educator. And she trains you for like 1 year. We've got a schedule for 1 year. We have a different RN resident cohort seminar for 1 year. And so we've got a schedule for the whole year. She's really organized. I really like her, And so yeah, come to Virginia Hospital Center if you haven't applied yet. If you pass RN exam, yeah. I mean, uh, I think you'll like it if you get hired. Um, I know the hiring people at Innova Fairfax Hospital. Um, from what I hear, a lot of people decided not to go to Innova Fairfax Hospital because they made them wait too long for the answer. Like after the interview, um, that's what I've heard. I've been hearing around me. So if you're Innova Fairfax, and I know the Innova Fairfax HR people, but I'm sure you're watching the show. Uh, you need to let your interviewees know soon that they're hired if you're going to hire them. Because if you make them wait, that's just going to make them feel like they're not wanted, right? I mean, it's like anything, right? You go on a date with a guy and he doesn't call you for 2 weeks. How are you going to feel? I mean, being hired is kind of similar to going on a date, no? You don't think so? Like, you have a first date. That's like your interview, right? The guy asks you out, you go out on a date with him. That's like the first day interview. Obviously you may not like him, he may not like you. You may agree right there on the dinner. Let's meet for a second dinner. Um, that's what I generally do if I really like the girl. You set up like a tentative time um, in the first day. That way you both know where you are. I mean, women never said no to me. I don't know. I guess some women would say no. I've just never had women say no to the second date. But and it's always been pleasant because I say, hey, you want to meet for dinner next Friday or whatever, and then she'd be like, yeah, that sounds good, and then you say, yeah, let's kind of meet like this, and then we could like finalize it, or if there's anything that comes up, just let me know. Like you kind of tentatively, but it's kind of like finalized. Um, but you just kind of make it light, but so like you want to know immediately whether you passed or not, right? So when a guy like I tell the girl, hey, I really enjoyed today. You want to meet next Friday for dinner? Then you know that I like you, and then you can say no. I'm kind of busy next week. Just let the guy down easy or whatever. I never had that happen to me, but I guess it could happen. Um, yeah, and then then the guy knows that you're not interested, maybe, right? Um, so it's good to know right away. That way the girl can move on, the guy can move on. But the guy doesn't call you for 2 weeks, and then calls you 2 weeks later and say, "Hey, let's go on a second date." You may say yes, but you may not. Because you're upset that you didn't call for 2 weeks. You know what I'm saying? It's kind of like that with hiring, and I think HR people need to understand that. I'm not saying about Fairfax Hospital calls you back late. I'm not saying that at all. That's just what I've been hearing in the background from people. Um, and yeah. So if you're Innova Fairfax HR, you should let them know right away. If you're going to hire them, let them know you're going to hire them. Um, I got hired at Innova Fairfax Hospital and Born Secure Hospital the same day, and they let me know really soon that they hired me. After the final interview. Hospitals generally put you through several interview cycles. Well, I don't know, it may be different for each hospital, but I went through several interview cycles. Um, you know, um, at some hospitals, like Boone Secure Hospital, um, and and Virginia Hospital Center also has process, right? You have to like jump each hurdle. So hospitals have these process, but after the final interview, they let you know right away, very soon afterwards that you're hired. And so I see all my residents, RN residents at Virginia Hospital, they all are very happy so far. It's still young. We have 1 year to go, so let's let's talk 1 year from now. But yeah, I mean, I would highly recommend it. It's the favorite. It's my favorite hospital of all the hospitals that I worked at, like as a student nurse, and and I think you'll be very happy there if you're in my cohort, or if you're in other nursing schools. You may be graduating from, or you may have graduated from George Washington University Hospital or George Mason Hospital. And I know you watch this show all over the country, all over the world. Maybe you graduate from a nursing school in New York or Boston, or Pennsylvania. We have quite a number of people from Pennsylvania, like nursing school graduates who came to Virginia Hospital Center, and they're part of my RN residency cohort. Yeah, and you may just want to come to our hospital. In Pennsylvania, you have a separate RN license, so you have to apply for Virginia license because Pennsylvania does not participate in the multi-state license that Virginia has. But even so, we had these Pennsylvania RN license holders who applied to work at Virginia Hospital Center right out of nursing school after they passed NCLEX RN and got their Pennsylvania license. They opted to come and work at Virginia Hospital Center. So, I guess positive words travel. I'm sure, some of them came because of the positive things. And, I say a lot of good things about Virginia Hospital Center on the show. So some of them are like, applied to Virginia Hospital Center because of all the positive things I say about Virginia Hospital Center. So, yeah, so, but yeah, I mean, I think that's the way it should be in all RN residency program. For 1 year that you are a resident, you should let the resident who came into a unit stay in that unit. You should float that resident. I mean, I think that should be like the standard policy. I think that's the right thing to do. But yeah, I mean, that's just, my opinion. And I think because you don't want people to gripe about your RN residency program because then you're not going to have a next cohort, right? Like, Virginia Hospital Center has January cohort, right? People are applying to Virginia Hospital now. Some will apply in October, some will apply in November. Some may even apply as late as December. And even in January, like all the way up to the start date, you're going to have applications coming in because some people graduate in December. So December graduates may apply after taking NCLEX RN, and they may apply like beginning of January for the January cohort. You know what I'm saying? And Virginia Hospital Center is very good about interviewing and letting you know early, so you can go really fast. So January cohort, you're gonna have people who graduate in August, but people who graduate in October, people who graduate in November, people who graduate in December applying. And if they have RN residents writing, it travels back to their home schools, right? And then they're not going to apply to your residency program, and you're going to have not many residents applying, certainly not many great residents applying. And you want the best of the best, right? Like me. Can I get a 5? The best of the best. Do you remember like Men in Black with Will Smith when he was taking the Men in Black test in that X-shaped chair? And they have that scene. This is the original first Men in Black movie. If you haven't seen it, you should see it. It's funny. He's like best of the best. All these top like graduates from Naval Academy, like Billy, or West Point and FBI, applying for this program, Men in Black. They have that scene where they're like taking this assessment test. It's funny. Yeah, I mean, there's different assessments, right? What makes you a great nurse is not necessarily that simple, right? There are like different dimensions to be a great nurse. Yeah, I mean, the world is a very complicated place. People have different belief systems. People come from different cultures. Different people have different, perspectives and views. And so it's a very complicated world. And hospital brings everybody in. There's people of all backgrounds. We have people who are former ex-convicts. We have current ex-convicts. Maybe, when I was working at the George Washington University Hospital, there were like 2 police officers guarding a convict, and I was taking care of this patient who has cancer in the oncology unit there. And so, so you're going to have that, in hospitals, right? Because convicts need hospital care if their situation gets bad. So you're going to have everybody there, of all backgrounds, all perspectives, and so, it's a microcosm of the society, people are different, and people care about their health. That's what they come to the hospital for. They don't care about other things, right, when they're dying, Yeah. So anyway, Obviously, I think Debbie, our chief educator, is doing it really well. And we had I guess we had like one of the biggest cohorts this year. Like my cohort, one of the biggest Virgin Hospital centers. So obviously Debbie's doing great job there. That's how it's growing. But you have to make sure you create a safe bubble zone for your RN resident nurses, right? Because you great nurses coming in with their new education, right? They're newly minted from nursing schools with evidence-based research. You need these nurses coming in, and you want the top nurses coming in, obviously. So yeah, you gotta take care of the 1 year of residence. And I felt like, and I guess others as well, I felt like Georgetown MedStar Hospital by floating RN residents with their preceptors, they're not taking care of them. It's kind of like if you go on a date with a girl and, oh, German. Ich liebe Deutsch. Ich liebe deutsche Frauen. Yeah, I said I love German. I like German women. You know, I like blonde and blue-eyed women, like from Germany or Netherlands or from Scandinavia, like Finland or uh, Denmark or Sweden or Norway. But there are a lot of blondes in England as well. Like one of my close friends at Georgetown University was Alice Judd from Newhall, Cambridge. She's pretty. She's amazingly pretty. And her father is a canon. I guess was he rector or canon of East Anglia. There's a church, She's pretty. So hi Alice. Yeah. Anyway. Yeah. So. Yeah. In the number. Well, this is different modification for Christmas. Christmas carol. Christmas bell. To be in the number. Well, some of you may be going home to heaven, during COVID Christmas. When Christ was born. Christmas Day. But you should say, thank you, God, that Christ was born. If you weren't born, you can't go to heaven then because you got to believe in Jesus to go to heaven in Christianity. And I'm an evangelical Christian. I don't lie about that. I'm Presbyterian Christian. Hiding facts is lies too, right? I mean, if I hide from you the fact that I'm a Presbyterian evangelical Christian, like, isn't hiding the truth type of a lie? Yeah, I mean, I'm not gonna lie to you. You don't want to create a society where everybody's lying to each other by hiding their facts, right? Hiding what they believe, hiding what their perspectives are. You create a society filled with lies, right? A fake world, or like fake news world, right? So don't muzzle people. We have First Amendment, so people can kind of be who they are and share who they are. Be honest with you, honest with themselves, honest with society. That's a better society. Society where you have First Amendment, where people can talk and share their views. I mean, you can't be like Facebook, like shutting down your accounts because you have an opinion, right? It's ridiculous. Christmas Day. Want to be in the number. So those of you who died from COVID, hey, your Christmas bell, maybe you'll be in that number. On Christmas Day. You may be in that number going home early on Christmas Day. This is wine on Christmas Day. Yeah, I mean, if you're true Christian, you're probably looking forward to going to heaven. Obviously, you can't take your own life because you go directly to hell. But yeah, I mean, if Christ brings you home early, I mean, I'm sure you won't be complaining necessarily when you get to heaven. Before you get to heaven, you think about your husband, your children, but let it shine, shine, let it shine, let it shine. I love singing. It's one of the great things about church. You go there and sing. I love churches where they have like singing for 30 minutes, A lot of like modern evangelical churches, they have a lot of good singing all the time. But some worship leaders, they pick up the worst songs. It's not that good. You have to have a worship leader who picks out songs that are good, that people like, catch the tunes and stuff like that. I'm gonna let it shine, let it shine, let it shine, let it shine. Yeah, today is October 16th. It's a World Spine Day. So if you need a spinal fusion surgery, or if you need like hip replacement surgery, knee replacement surgery, any kind of elective surgery, you should get it done as soon as possible because COVID-19 is going to flood every state. Come to Virginia Hospital Center, get your surgery done by our great hospital doctors, you know? Um, yeah. You love it at Virginia Hospital Center. People are so nice. Everybody's really nice. Doctors are nice. Nurses are nice. Occupational therapists are nice. Everybody's nice, you know? Yes, 1,000 people are dying every day in America right now. Why do you think I'm having this Christmas show with Here's for You? uh, so, gonna let it shine. Never mind. I'm gonna let it shine. Mine. I'm gonna let it shine, let it shine, let it shine, let it shine. Yeah, yeah, I enjoyed my time in Cambridge. I can't lie to you. I love dressing up in tuxedos. You know, it's like James Bond. You know, James Bond. You know, Heerak Heerak Kim. I don't know. It doesn't have the same feel, but yeah, you know, one of the great things about England's Christmas parties is they give you these paper like crowns. You know, like the three kings who gave gifts to Jesus, right? I guess that symbolizes that. So I wore a green hat because I love Irish people. Is that like many of them are blonde and blue-eyed or redhead and green eyes? Like, is that my favorite? Um, I'm not married yet, and hopefully God will send me somebody to marry who's beautiful and thin and tall, you know. But anyway, yeah, that's like that's the most important thing for me. After being a Christian, that's like a given. Like you have to be pretty and thin and tall. Well, you have to be pretty. You don't necessarily have to be tall. There are a lot of beautiful women who are like not tall. But yeah, you have to be beautiful and thin is like the beautiful is first and then thin is second, tall is third. Those are like, yeah, they have to be kind of But anyway, yeah, so Martin Wood, the royalty English or Scottish royal, was my best friend at Cambridge University. He did his PhD in physics. So we used to go to parties all the time, and yeah, so we had some beautiful women in our Jesus College. So it was an in-house party. You could bring guests, but I mean, why bring guests when you have a lot of beautiful people in your home college? I was single at Cambridge, so yeah, it's a time to connect with your college members and the single women you could hook up with or whatever, yeah, and then yeah, so I'm there with my friends. Let me point out to you the one with the yellow crown. He's a prince from Georgia, the country of Georgia, in former USSR, and he came to Cambridge to his PhD in law, and now he's a professor of law at Oxford University. Royals stick to each other. They help each other along. All the royals around the world connect, but especially in European area like Russia, former USSR, Germany, France, Scandinavia, Netherlands, Spain, they all connect. They get together and go to the same kind of parties for royals. So yeah, you may not know that if you are a you know ordinary Joe. I'm an ordinary Joe, but I have a brain, and all the royals are really into brainy people. So royals wanted me around. That's why Martin was my best buddy. Yeah, and yeah, this is like a Nutcracker program, you know. And yeah, I'm gonna miss nothing if to go see Nutcracker this winter. I organized the University of Pennsylvania Alumni Association Nutcracker Ballet event at Strathmore Theater in Bethesda, Maryland. The Penn Club of DC, where President Trump is a member, Ivanka Trump and Tiffany Trump members. If you graduate from Penn, you're automatically a member. Yeah, like really a lot of people come. You know, we sold out all the tickets. I raised for like group tickets and everything, whole thing, whole shebang. It was fun. You can go to like Penn Club of DC Facebook page and see the photos. But you have to be given permission to be to allowed into Penn Club of DC Facebook. Yeah, I don't know. I believe they're supposed to be exclusive. They're not just gonna let everybody in. So you know, because these are all like really famous people in DC. You know, a lot of people are like CEO, like um, former vice president of Penn Club of DC is like CEO of Innova Fairfax or Innova Health. I think it's Innova Fairfax or Innova Health, you know. And I took his position and became the vice president after him. And he lives in like a big house in Fairfax. Um, yeah, we had some executive board meetings there for Penn Club of DC. So you have like people like that, you know, everywhere. Like not just in healthcare systems, but like in politics, you know, um, in business, law, medicine, nursing, so that's why it's a closed group. So in order to see the photos from our events, you need to be allowed in. And they only allow in people who are Penn alumni. So they check their name against the list and everything, and they go through the whole thing. So yeah, it's exclusive, you know, when you say it's Penn. Yeah, I'm sure there are a lot of top executives. They call it C-suite, people like chief executive officer, chief nursing officer, chief medical officer, and you know, my Fairfax Hospital who are Penn alumni. Uh, you know, but anyway, you know, I'm your vice president. You know, if you are part of Penn Club of DC, I'll be starting my interview cycle for high school students who apply to University of Pennsylvania early decision. The deadline is November 1st. If you haven't submitted an application, you submit it. You know, I mean, don't pay money to come to Penn. You know, because you end up in jail. We know from the news, people trying to get in by paying off like coaches. Don't do that. But it is hard to get in. I've interviewed like 28 people last year, and they're all like amazing. I mean, you should see their portfolio. They're all like amazing. But you know, we can't accept everybody, so I have to read them out during the interview process. You know, yeah, and let the admissions office know. So you know, admissions office, wants me to interview more people this year. You know, I've been doing it for like a long time, over a decade. So, so my first batch of early decision applicants will come in a few weeks, and I'll be interviewing them. This year we're going 100% virtual online. Um, yeah, so I'm looking forward to it. You know, some of the most important people in the area, their children will be applying to Penn early decision. I'm interviewing their children. I like all these boarding school kids applying. Like boarding schools that are like $60,000 a year or more. you know, yeah. I mean, the cost of annual attendance at a boarding school um, is higher than how much nurses get paid in some areas. I interviewed one student last year who's African American, and his mother uh, is like a big shot, like nurse executive. I guess it's nurse executive or healthcare executive in this area, in Washington D.C. area, and he went to an exclusive boarding school. Uh, but his sister goes to, I guess, Ludor public schools. Like she's in middle school, and she's trying to see if she wants to go to an exclusive boarding school or not. So he was sharing with me, and so she applied to go to his boarding school. So we're talking about that a little bit. But yeah, like his mother is like one of the top movers and shakers in the healthcare systems, like a big healthcare system in this area. But so you get to interview a lot of interesting people and their children. They talk about their parents. You learn a lot about people. And sometimes you know these people. And you hear all these kind of things about their parents. This is kind of impressive things. The children tend to say a lot of impressive things about their parents. You learn something that you didn't know. I mean, but mommy's the word, of course, just stays there. Whatever is independent of you stays independent of you, Yeah, I don't share that kind of thing with the missions office, so, Um, yeah, I mean, things that are well, it's not like they're confidential, but I just generally talk about the applicant and his or her achievements, to support or his acceptance, waitlisting, and rejection, but generally the panel interviews are more about how you come across as an interviewee, right? I mean, exclusive schools care more about that than your actual academic record. Because obviously, to apply to a school like Harvard or Penn or Princeton or Stanford, you have a very good academic record, right? That's where you're applying. So what they want from the interviewers like me is to basically separate wheat from the chaff, right? They know like majority of these kids are like from amazing families who are like graduates of like Harvard Med School or Stanford Law School, or Wharton Business School or whatever, who are movers and shakers, senators' sons, House of Representative member daughters, these amazing people. Um, so what they want to know from the interview, and I'm very good, they trust my judgment fully, is the applicant himself or herself, does he or she have potential to be a great leader in the future? That's what they want to know, right? Should they give one spot to this applicant who's going to succeed in the future or fail in the future? That's what they want to know. Because there are a lot of children of very successful parents who don't succeed like their parents. Some even fail, so they want me to weed them out for them. And I'm so good. I've hit it on the nail so many times. Like people I've recommended acceptance to like over 10 years ago, they're like major leaders now. So they could trust my judgment because they follow, like great people, great alumni. I had a I had a one page alumni use on me, because I'm an amazing person, and it was on my being a Jewish studies expert. You can Google it and find out. Google my name and alumni, and you can read the one page spread on my University of Pennsylvania The Gazette alumni magazine. I'm an amazing alumni, Um, so they trust my judgment, you know, um, and they know that whoever I say will be great will has very high chance of becoming great. I've been right more than 90% of the time, so I don't think I'll be wrong. If I say this person is great, that person will be great. I don't have doubt about that. So, I stand fully behind my recommendations to accept, reject, and wait list. I've been right. I have a track record of being right that University of Pennsylvania admissions office has been keeping. So, yeah. Anyway, yeah. So I'm looking forward to my next 28 batch. In the early decision, I submit by like November 25th, and then the applicants find out like December 15th whether they accept, reject, or like deferred. Uh, it's kind of like waitlist. You get considered with regular people. um, the April decision. And then I interviewed from like January 1st to I guess like Valentine's Day, and I submit my report around Valentine's Day for the regular decision. So yeah, I'm looking forward to doing that this year as well. But yeah, 1,000 people have died. About 942 to be exact in the last 24 hours. So confirmed cases of COVID-19 stand at 8,800. No, 8,008,402. I did do a 7 p.m. to 7 a.m. shift just in case. Yeah, and then the death rate is at 218,097. So it's going up and up. I'm predicting that minimum 3 million Americans will die. I don't believe the liberal media who says like, oh, a few 100,000 people will die by April. Are you kidding me? 300,000 people die in the flu season? No, we're talking about millions here. Yeah, I mean, I'll keep you updated so you can follow along. Um, the top five cases of COVID in Middle East. Number one is Iran. They have 522,387 cases. Their death rate is at 6%, which is kind of high, but we're going to hit 6% easy during flu season. We may even hit 10% death rate, maybe even higher than that. When the ICU beds run out in certain areas of United States, you may even have 20% of the people who have COVID die. Yeah. Because if you don't have ICU beds and ventilators, you're going to die. Yeah. Many of you. Yeah. What do you think ICU beds are there for? To keep you alive. If you don't have it, you'll die. You know. Iraq is second. 420,303 cases, 2% death rate, 10,142. Death is climbing. Remember, like just a short while ago when they had like less than 6,000 deaths? So Iraq is like, their death is spiking now, which is disturbing. Saudi Arabia, death is rising too. It's beginning its spike. So if you're in Saudi Arabia, you should worry, especially you princes in Saudi Arabia. You should really worry. Because you may die off, some of you. 341,495 cases, 2% death rate, 5,144. And if you live in a kingdom, one of the problematic thing is you have a dynasty, right? And during uncertain times, like war or during pandemics, your dynasty can end. You know, so that could happen in any Arabic nation with a dynasty, with the ruling family. Your wealth can transfer to another family that may overthrow you, or you know, God forbid, if like majority of you die from COVID for whatever reason because it spreads through your parties, then you know you die off without any kind of overthrow of your kingdom. But because you guys all die off, you know, someone else will have to fill that spot. So these things happen in history. Could happen in Saudi Arabia. It could happen in like other kingdoms throughout the world during COVID-19. So I would recommend not throwing any parties. You know, because you go to the party, you're gonna have all the royals there. You know, all of them can get COVID and die. I mean, geez, is that how you want to end your empire or your kingdom, Saudi Arabia? You know, I'm just saying. You know, I'm just trying to give you good advice. You know, so your kingdom can continue long and prosperous. Israel, death rate is rising. You see now they have over 2,000 deaths, 301,896 cases, 2,141 deaths. It's rising. You have 6 more months of flu season to go. Israel could have 1 million die. Have you been to Israel? They live like sardines. Like in Bat Yam, every apartment is like sardines. Holon, Ashkelon, Beersheba, Jerusalem, Tel Aviv. Like you could have 1 million people die. But 1 million Jews die in Israel because they all live in like these apartment complexes. Palestinians generally live in their single homes, so you're not going to have many Palestinians die off from COVID. Because if you live in a single home, you're safer. There are fewer Palestinians living in wider areas, so Palestinians tend to live in a single home. So you're not going to see too many Palestinians in West Bank and Gaza dying off. But in Israel, the Jewish nation, which has skyscrapers, you know, wealthy people like to live in skyscrapers and cities, right? But during COVID-19, that's like death zone, right? And even poor people in cities in Israel, it's very densely populated country. You could have 1 million people die in Israel. I mean, you should probably continue to shut your country down for like next 6 months. I mean, you could open up. I mean, if you're going to risk like 1 million people dying, go right ahead. Qatar has 128,992. You only have 12 million Jews in the world. So 1 million Jews die in Israel. That's like 11 million Jews left in the world. I mean, geez. And that could happen in 5 months. Yeah, it's going to be bad. It's going to be like COVID-19 Holocaust. Yeah, COVID-19 little virus killing off like million people, million Jews in Israel. Yeah, and if COVID-19 kills off like a lot of Jews in New York, I mean, you may have 2 million Jews dying off in the world during COVID-19, 6 months of flu season. Because in New York, COVID hotspots are in like Orthodox Jewish communities. 1 million Jews can easily die in America. in major cities like Philadelphia, New York, um, during COVID-19, 6 months of flu season. Yeah, you don't think that could happen? Well, let's talk in April. Let's see. Um, Qatar is 128,992 cases. Death is at 222. But that sounds like small, but it's growing, right? It's growing from double digits to 3 digits. Yeah, I would worry if I'm in Qatar, because once you start growing, you don't know how it's gonna go. You saw a little baby when she was born in the hospital. She she came from a fertilized egg, and she grew, and then you saw your baby grow from birth, and now look at her. She's like a fully woman at 18. Well, think of COVID-19 spreading like that. It only takes a little spark to get a fire going. Then it grows and grows and grows, and it's like big. You want to celebrate many Christmases? Yeah, you gotta shut down. Stay away from crowds. Um, yeah, so today's headline is COVID-19 USA. How many COVID-19 deaths by Christmas 2020? As I said, I'm unfortunately, expecting 5 to die from my cohort of 25. 20% of us will die because, nursing is the most dangerous profession in the world. Like, if you don't want to die from COVID and you're a nurse and you have money saved up, just take off like next 6 months. Like, if you have children at home and you have enough money saved up, or you could do telenursing, right? You could apply for a job where you do telenursing, you do it from home. That's what you should do if you have children, like baby children. You may not want to risk death from COVID because a lot of nurses are going to die. Um, but yeah, I mean, it's your life. You do what you want. God may not protect you from that because maybe God wants you home earlier, and God works through a natural process. So if you are jumping off of a cliff, you're going to die. So don't jump off a cliff. You don't say God's going to protect me and then jump off of a cliff. He's not going to protect you. I mean, he may perform a miracle, and that does happen, but probably not. You know what I'm saying? Miracles are miracles because they rarely happen. So if you're a nurse, a good Christian, evangelical Christian nurse working in a hospital, in intensive care unit or emergency room, there's high chance you could get COVID. You may not die, but you may spread it to your children or your husband, and they may die, or you may die and they may die too. That could happen. God works through the natural rules that he put in place when he created the world. And when the world fell and the creation fell with the sin, disease proliferated, bacteria and virus, and bacteria can kill, viruses can kill. And so, yeah, I have two articles that are significant. Christie says he was in ICU for 7 days, battling COVID-19, urges Americans to wear a mask. So he was in ICU for 7 days, which means he could have died. That's what it means. This is by Dure Gregorian. Anybody who goes to ICU, that's critical care, you could die. I mean, they're not going to send you to ICU unless they think that you could die. But thankfully, Governor Christie discovered early that he had COVID and he was smart enough to go to rush himself to the hospital. Because if you wait to go to the hospital, 24 hours could mean difference between life and death. Especially if you're overweight like Governor Christie. As soon as you're diagnosed with COVID-19 and you have problem breathing, go to the emergency room. I mean, come to Virginia Hospital Center. You don't joke around with COVID-19. 24 hours could mean difference between life and death. Don't joke around with it. Wish you a Merry Christmas, a Merry Christmas. We wish you a Merry Christmas. We wish you a Merry Christmas and a Happy New Year. I mean, what? Just because your daughter dies of COVID-19, not going to celebrate Christmas. It's Jesus' birthday. You have to celebrate Christmas. It's Christmas. If your daughter is born again Christian, in the Christian system, she goes to heaven. So, you know, yeah, you suffer grief as a mother, but she's in heaven if she's true Christian according to Christianity. So, I mean, there's no problem celebrating Christmas, right? You and your queen. Wish you a Merry Christmas, Happy New Year. Remember, for true Christians, going to heaven uh, is a good thing, right? If you're a true Christian and you're truly born again Christian, you can't commit suicide because you commit suicide, you go straight to hell. But because you're taking your life in your own hands. But if you happen to die from something like COVID, I mean, Jesus, you're going to be with Jesus Christ when you die if you're a true born again Christian according to Christianity. So it's not a bad thing necessarily. Obviously, you're going to Virginia Hospital Center. We're going to try to save your life, because we know you have a family and you come to hospital to be saved from your COVID-19 death. So we'll do whatever we can to save you from your death. But Christians are going to die. Many Christians are going to die. Millions of Christians may die in America. Obviously, if you take the risk, you have higher chance of dying. I mean, God's not going to perform miracles to save your life when you put yourself in harm's way, either as a public school teacher teaching children in class, you're putting yourself in harm's way. So you get COVID and die, don't blame God. You put yourself in harm's way. You could have taken a leave of absence. You could have done whatever you could to prevent death, but your priority wasn't preventing your own death. So if you die as a public school teacher, and I'm a public school teacher, right? A licensed public school teacher. If you don't take a leave of absence and you teach in class, you get COVID and die, you have no one to blame but yourself. You took that risk, now you have that death. People take their risks and they need to suffer consequences that come with that risk. Every nurse who works in COVID-19 America takes the risk voluntarily. So if you die, then you took the risk, you have died, right? You could die. If you're a teacher who doesn't take a leave of absence, you're taking the risk voluntarily. So don't be going and complaining to God when you get COVID and you're in deathbed. You took the risk, right? You took the risk voluntarily. Yeah, so this article by Derek Gregorian, October 15, 2000, God's not going to protect you from COVID-19 death. You put yourself in harm's way. I mean, this is like natural law that God has worked through with God's people for thousands of years. God's not going to perform miracles to save your life. God does that rarely. He does that sometimes, but when North Koreans invaded South Korea, my mother's father was a famous Korean Presbyterian pastor, and he was on their death list, blacklist, because he was a famous preacher of the Christian gospel, and North Koreans are anti-Christian. So he was on death list, so like communist intelligence units were hunting him down, kill him. They had these pastors on the death list, Christian pastors. The communist is anti-Christian, right? So he was in hiding, and one of his deacons took the money because these intelligence networks were paid to. It's kind of like what the Jewish chief priest intelligence network did with Judas Iscariot, right? They gave him 30 shekels of silver to have him sell out Jesus to die, right? And we read that in Matthew, Mark, Luke, and John. So they had that in North Korea during the Korean War. So they had these intelligence units going around, offering money. They had the names of churches, so they did their investigation. It's like a FBI investigation. But during the course of war, they would go and investigate who the leaders were and try to gain access and to find out where the pastor is. All the elders and deacons lied about it, and so my grandfather was safe, but this one deacon took the money, 30 shekels of silver, I don't know how much it was, and then toward the communist North Koreans where my grandfather was, so he was arrested and executed. Right? He knew there was a risk. Like there's a risk to being a Christian pastor. Obviously, during times of peace, there's less risk. But when you're being invaded by a socialist government, communist socialist government, Marxist government, like North Korea or Cuba or Venezuela or China, then your life comes into risk, right? Situations create a risk, and you have a higher chance of dying. And so my grandfather was killed off by communists for being a Christian leader. In the same way, being a nurse during non-COVID American, non-pandemic situation, it's kind of the safest job in the world. But during COVID-19 America, it's the most dangerous job in the world. So teaching, well, teaching is not as dangerous, but teaching in a classroom filled with students, that's pretty dangerous too. So if you continue to work in these settings, obviously you're volunteering your life, right? You're taking the risk intentionally, right? Also, God's not going to protect your life when you're putting yourself in harm's way, right? So don't think God's going to protect your life just because you continue to teach in a public school or you continue to work as a nurse. No, God's not going to protect you from COVID-19 death if you don't take the precautions to protect your life. God's not going to go out of his way to perform miracles to protect your life for you volunteering to continue to work as a teacher in a classroom. No, you're going to die. You could die if you don't take the precautions. Obviously, if you take the precautions, you're not going to get infected, you're not going to die. But, there's a high chance you could get infected because COVID-19 is airborne. It's floating all around your classroom. So, you have 30 students from different households, not properly wearing masks. You're going to have COVID-19 floating everywhere at some point in the next 6 months. The significant quote from this article is, you may sleep in heavenly peace forever, once you die from COVID before Christmas. Right. You'll be heavenly peace if you believe in Jesus. According to Christianity, then you go to heaven, so you're in heavenly peace. I believe that when I entered the White House grounds, that I had entered a safe zone. There is no safe zone in COVID-19 America. There is no safe zone. 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 Oh, yeah, nothing's broken. I'm just repeating it so you get the point. There is no safe zone. There is no safe zone. Yeah, get that straight through your head. There is no safe zone anywhere in the world right now. I believe that when I entered the White House grounds that I had entered the safe zone due to testing that and I and many others underwent every day. Testing only tells you whether you've been infected. It doesn't protect you from COVID. I was wrong. Oh, no. I was wrong to not wear a mask at Amy Coney Barrett announcement. How many times did Heerak Christian Kim, independent candidate for U.S. Congress of Virginia State District, tell you to wear a mask wherever you go, outside of your home? How many times? Jeez, for God's sake, I've been saying that since April 2nd when this show started. This is why this show is here, to protect your life. You could have died. Governor Christie, if you didn't listen to Heerak Christian Kim, independent candidate for U.S. Congress of Virginia 8th District, and maybe you will die if you don't listen to Heerak Christian Kim, independent candidate for U.S. Congress of Virginia 8th District, if you just ignore all my advice. Like teachers, many of you are going to die. That's not going to protect you. Doesn't matter if you're truly born again. Maybe God wants you to come home to heaven. Why do you presume that God wants you to live on this earth? Yeah, that's really presumptuous, Right? You think like you want to live. That God's interest is maybe having you die. If you're born again Christian, don't assume God wants you to live. That's presumption. As I said, God is not going to perform a miracle for you so you'll live when you put yourself in harm's way. You're taking the risk. And if COVID-19 gets into your nose or your eyes or mouth and you get infected, you're going to suffer and you may die. If there's no ICU bed, you're going to die. God's not going to perform a miracle for you. That's like 99.99999% true. Christmas is great time. It's joyful time, If you're not dead by Christmas, at least you can celebrate Christmas with your family. But even if one of your family members is dead, you celebrate Christmas, the birth of Jesus. Uh, to the world, the Lord has come. Yeah, we celebrate Christmas because Jesus has come, right? Your child dying from COVID-19 because you're a teacher and you infected your child doesn't change the fact Jesus has come and we're celebrating Christmas, right? You know, God's not going to perform a miracle to save your child's life if you put yourself in harm's way and teach 30 children from different households every day in a closed room, you know, when COVID-19 is airborne. And that's what all the scientists are saying, it's airborne. It's all around the classroom. You may not have gotten it because maybe all 30 children don't have COVID yet. But that's going to change in the next 6 months. Yeah, so, and I was wrong not to wear a mask, and my multiple debate prep sessions, with President and the rest of the team. I mean, yeah, remember, President Donald Trump got COVID, his wife got COVID, his son got COVID. The government's top infectious disease expert, Dr. Anthony Fauci, last week called the Rose Garden event where few attendees were masked the super spreader event. God's not going to protect you if you don't wear a mask. That's why Heerak Christian Kim, independent candidate for U.S. Congress and Virginia 8th District, and an expert theologian says always wear a mask everywhere, including churches, because God's not going to protect you from COVID-19 infection during worship times if you're not wearing a mask. I'm predicting that minimum 20% of everybody who go to church to worship will die from COVID-19 flu season, 6 months. 20%. So 100 million American Christians go to church, 20 million of you will die. But not everybody's going to church right now because of COVID. Some churches are not worth going to. They're not following the Bible. Because God wants obedience rather than worship, right? God told King Saul, God wants obedience more than worship. So if you're going to go to worship service, but you're not going to obey the Holy Bible like Romans 1, don't go to worship. You know, God wants you to obey more than worship. God made that clear in the Bible. Yeah, going to worship is not as important as obeying God's law. Very important. If you go to worship and do not obey Romans chapter 1, you still have worship. Better for you not to go to worship. Yeah. God wants obedience more than worship. Don't forget that. It's a biblical position, number one. Martin Luther did not go to church for 2 years because he was hiding out from all the liberal Christians who wanted to kill him in the known world. Every church wanted to kill him. For 2 years, he was hiding out because if he steps a foot into any church, anywhere in Europe, he would have been arrested and killed right away. Yeah, so worship is not that important compared to obedience. Remember that. Martin Luther did not take a mass for 2 years. Martin Luther did not meet with other Christians for 2 years. He was in the cemetery for 2 years by himself. He did not meet with any Christians for 2 years. He did not worship with any Christians for 2 years. He did not step inside a church for 2 years. Yeah, because he was trying to follow the Bible, just shall live by faith. I mean, the Catholic Church reformed itself, thankfully. So it's not teaching like, oh, you could buy indulgences, you could buy salvation. You know, that was in Martin Luther's time, you know, and it's changed. So, but at that time, you know, Martin Luther did not go to church for 2 years. Don't go to church for 2 years if your church is not going to follow Romans 1. That church itself may be a vegetable of eternal damnation if it's not following Romans chapter 1. Don't go to your church. Yeah, it's not, whether it's called evangelical church, Baptist church, doesn't matter. If it's not following Romans chapter 1, don't go to that church. Yeah. But obviously, if you want to worship God in a church that truly follows the Romans chapter 1 and Bible, then go to that church. You know, and if you die from COVID, more power to you. You'll be in heaven, right? Paul says to live is Christ. What does he say? To die is gain. So if it's a church that follows Romans chapter 1, go and worship if you want. You know, that's your choice. But it's not like you're not going to go to heaven if you don't go to church for 2 years. Martin Luther is not going to church for 2 years. Because every church wanted to kill him. Because the churches, 100% of the churches went out of the Bible in Martin Luther's time. It happens, you know, throughout history. Second article is overwhelmed. Hospitals engulfed by rebounding virus. Dan Goldberg of Politico. The coronavirus is engulfing big city hospitals in states, including Utah, Wisconsin, and Indiana, that are running low on nurses. Yeah, I'm an RN, registered nurse, and beds that are being forced to set up overflow facilities. Big cities are running out of hospital beds already. And it's October. You have 6 more months of flu season left. October, November, December, January, February, March, April, May. And you have 8 months of COVID-19 spiking death left for 6 months of flu season. I'm predicting more like 30 million American citizens will die. Because some of these idiots are not wearing masks at church. Don't complain if you get COVID and die because, hey, you put yourself in harm's way. You did this to yourself. I told you, Heerak Christian Kim, independent guy from U.S. Congress, said, wear a mask or you will die. You didn't listen to the theologian expert. I'm giving you my expert advice as a theologian who knows the New Testament back and out, Old Testament back and out. I'm a certified expert of theology, New Testament, Old Testament, and you're not going to listen to my advice? Well, then, you deserve to go to hell, not hell. Well, if you don't believe in Jesus, but if you deserve to die of COVID if you don't follow the theological guidelines, right? My theological guidelines as an expert theologian is anyone who does not wear a mask in a church would not be given a miracle protection from COVID-19 death. God doesn't work that way. God works through nature. God has no problems with millions of Christians dying. You know how many millions of Christians have died throughout history following Jesus? And we call them Christian martyrs. You know how many Christian missionaries have died trying to missionize Ireland before St. Patrick succeeded in Christianizing the whole country of Ireland? The whole country of Ireland was pagan. They followed a different religion, the whole country of Ireland. They killed every missionary who came to talk about Jesus in Ireland until St. Patrick. You know how many died trying to Christianize Ireland? You think God protected their life? No, God doesn't. All 12 apostles were killed by Roman democracy, which did not like the fact that 12 apostles opposed religious liberty, religious pluralism. So they arrested them because they kept saying Jesus is the only way to salvation for hate crimes against democracy. And they were killed, all 12 apostles. Do you think Jesus performed a miracle to protect their life? No. Why do you think your life is going to be protected from COVID-19? That's not going to protect your life. I'm an expert of theology. I'm giving you evidence for evidence why you're going to die from COVID-19 if you don't wear a mask. Even if you wear a mask, you may die from COVID-19. Because COVID-19 is airborne. Anytime you go to like a mass gathering, even with a mask, you get COVID. So the important quote continues. With new daily U.S. cases surpassing 62,000 on Thursday, that's yesterday, today's Friday, the prospect of swamped intensive care units is prompting some governors who previously resisted public health orders to weigh new restrictions to ease pressure on their healthcare system. You cannot create RNs overnight. If 100 RNs die, registered nurses die, in Northern Virginia in the next 6 months, you can't replace them. They're going to be dead. It takes like many years to train an RN, registered nurse. Fewer the nurses you have who can treat you, higher the death rate. That's coming. There's a lot of nurses that are going to die before Christmas. And then a lot more nurses will die from Christmas onwards. Flu season is 6 months long. And there'll be death and death proliferating until May. That's October, November, December, January, February, March, April, May. 8 months of proliferating, exponentially growing death rate. That's not going to stop. Why do you think millions of Americans will not die? Are you kidding me? Of course they're going to die. We're talking about science here and basic math, right? Compound interest. It's going to keep growing. The way COVID-19 cases and death grows, it's same as compound interest. So if you are in business world, you know what that means. Millions will die. That's like 99% certain. Millions will die in America in the next 8 months. No vaccine, no cure. Millions will die. And if you arrive at an emergency room like a day late, you may die. There were 3 Orthodox Jewish men who arrived in the emergency room, died within several hours because they did not come in earlier. Had they come in 24 hours earlier, maybe they would have been like Governor Christie and not died. They could have been in intensive care unit for 7 days and survived. But they waited too long to come into the emergency room until they got really sick, and then they died a few hours later because it was too late for them. Time matters. Time matters when you talk about emergencies in healthcare. From the early days of the pandemic, the availability of ICU beds and hospital ability to treat people who need life support, equipment like ventilators to breathe, has been an important benchmark for whether local health systems can handle outbreaks. A lot of people are going to die. I'm predicting that minimum 100,000 people will die in Virginia. Minimum 100,000. We may have hundreds of thousands. We may hit over 1 million deaths. We have 8 months of proliferating death to go. And we have Halloween parties and trick-or-treating coming in October. That's going to show us how much more proliferation is there in Virginia. So death in Virginia by May could go from tens of thousands to hundreds of thousands. And it could even go to over a million deaths. There's no rule that says 1/3 of Virginia cannot die in the next few years from COVID-19. There's no rule. But in science, that is possible. God works through science. Do not think God's going to protect you from COVID-19. He will not. He will not. If you put yourself in harm's way, you will die. You'll get it, and some of you will die. God will not protect you from COVID-19 if you put yourself in harm's way. That's how God works. He created this world. He created the viruses and bacteria to function in the way they do. Bacteria is a creation of God. COVID-19 is God's creation. God loves COVID-19 like he loves every living organism in America. You think God loves you more than COVID-19? What have you done to earn his love? Let's be honest here. You think you deserve to live, to have a miracle from God? What did you do to deserve a miracle from God? I'm betting 99% of you watching this show don't deserve a miracle. You're going to die from COVID-19 if you don't take the precautions. You put yourself in harm's way, you're going to die. You're going to get COVID and die. You have to take the precautions. Can I get a 5 on the precautions? Can I get a 5 on the precautions? Some of you are seeing red reindeer jumping by. And maybe you should, because it's the red reindeer kind of a moment, you know? Because think about it. You may die before Christmas, right? If you're a teacher, your chance of dying before Christmas is very high. Think about if you're evangelical, born again, Christian who speaks in tongues, prophesy. You know how many prophets were killed? Prophets died, right? When Jesus accused Jewish individuals and said in the Gospels, Jerusalem, Jerusalem, you who killed the prophets. Obviously, prophets were killed by Jerusalem or Jews in Jerusalem because prophets can get killed, right? I mean, that's why Jesus said, Jerusalem, Jerusalem, you who killed the prophets, right? I mean, geez, don't think God's going to perform a miracle to save your life from COVID-19. He's not. Okay, don't be lying to yourself saying, oh, God's going to protect me and my family from COVID-19. He's not going to protect you and your family from COVID-19 if you don't socially isolate, if you continue to socialize with everybody. You're putting yourself and your children in harm's way. Of course, God's not going to protect you. Why do you think God's going to protect you? What makes you so special? Okay, all these prophets died, were killed in Jerusalem by people who didn't want to hear God's word, like Romans chapter 1, right? Or Deuteronomy, equivalent of Romans chapter 1. So why do you think you're going to live? You can die. God's not going to perform a miracle for you and your family. Are you kidding me? And I say this as an expert theologian, as a certified expert, as a published theologian, who's respected around the world among other theologians. Um, God's not going to perform a miracle for you. So don't expect it. Um, expect to die from COVID if you're not taking precautions. That's the biblical principle. Um, yeah. So yeah, you may die before Christmas, and I'm playing this Christmas music because you may die. I'm expecting minimum 12 nurses to die at Virginia Hospital Center. That's just nurses. I'm sure there's going to be equivalent or more dying from surgeons, from physicians groups, from occupational therapists, physical therapists, respiratory therapists, patient care techs. And it's not just Virginia Hospital Center. It's from Fairfax Hospital. 12 nurses are going to die minimum, maybe more because it's a bigger hospital. Fairfax Hospital, Alexandria Hospital, minimum 12 nurses are going to die. Next by Georgetown Hospital, minimum 12 nurses will die. That's what I'm saying. If you're a nurse who has pre-existing conditions like diabetes or fat, and you're old, like over 50 or 60 or 70, maybe you should take a leave of absence until May. If you don't want to die. If you continue to work, you're voluntarily taking the risk to die. So I want you to know what you're doing, right? I know what I'm doing. I know I could die from COVID, but this is where I am, and this is how God called me to. And if God calls me to go to U.S. Congress because you vote for me on November 3rd or in absentee ballot or in early voting, I'll go to U.S. Congress if that's what God wants me to do. But if not, I'll continue to work in the Virginia Hospital Center, um, and maybe I'll end up treating you, But you have to know the risk you're taking. Don't go you should live a life based on a lie. You should live a life knowing what the consequences are for actions that you take. You should take risks, knowing the risk. And, we call that informed consent. Informed consent is knowing the risks before you take the procedures. But you say, well, the benefits outweigh the harm. So we will take the risk, right? Um, I created this show to save you and your children from COVID-19 death. And I'm telling you, we're headed toward COVID-19 death in large numbers. I'm predicting that minimum 3 million people will die from COVID, but more like 30 million by next May, just in the United States. Around the world, I'm Heerak Christian Kim, independent candidate for U.S. Congress of Virginia's 8th District. I'm predicting that 100 million people around the world would die from COVID-19 by next May. And I'm predicting that there will be no working vaccine that's safe and effective for the next 10 years. So I'm predicting that potentially in the next 10 years, we can have 2 billion people dying from COVID-19. This will be exponential growth. Well, there are people dying from HIV/AIDS every year. There are people dying from hepatitis C every year. There are people dying from cancer every year. Why do you think COVID-19 is just going to disappear? Doesn't make sense. It's a 365 days a year virus. There's no evidence to say it's going to disappear. Where are you basing this theory? Your theory has a lot of holes. Those of you who are saying that it's going to disappear after 2 years, it's not going to disappear. Why do you think it's going to disappear? It's a 365 days a year virus, which means it's going to continue perpetually through human hosts without stop, forever. Host to host, host to host. You know the route of transmission, right? That's like biology 101. For every nurse, every doctor, every biology student, route of transmission is going to be continuous. 365 days a year, it's not going to disappear. Yeah, don't think it's going to disappear. It's not going to disappear. Yeah, so anyhow, I hope you're not going to be among the number who die. 3 to 30 million Americans who die by May. Obviously, I don't want you to die. That's why I have this show that tries to help you to escape COVID-19 death. But if you put yourself in harm's way, you only have yourself to blame. I think that's a rational thing to say. And I think you understand that in a rational term. If you jump in front of a moving car, you're gonna die. Doesn't matter if you're born again. It doesn't matter if you're praying for a miracle. You jump in front of a car, you're gonna die. You see what I'm saying? It's the same thing. COVID-19 is following the rules of nature, rules of creation that God Himself created. If you jump in front of COVID-19, you're gonna die, or you're gonna get it and you may die once you're infected. This is one of my favorite. Jesus was born into that's like humility, right? There was no inn open, so Jesus was born inside a manger where animals live and poop. You know how smelly that is? They poop all the time. Jesus was born in the worst possible place with pooping smell, with cows and animals, crying. And can you imagine that? All the brouhaha. Yeah, our Jesus was born into abject humility. And it's God. He took on human flesh. And He came to this earth. He chose to be born in that way. He didn't choose to be born in a castle. He didn't choose to be born among parents who are billionaires, because He could have. But He chose to be born from a virgin woman who was a teenager, probably 14 or 15, maybe younger. Romeo and Juliet were 13 when they got married. Obviously, thank God, Mary did not abort her baby. Um, this is why I hate abortion. Because you don't know what the baby's going to be. The baby you kill. She could become a U.S. Supreme Court justice. She could be the first female president of America. She could discover a cure for AIDS or maybe cure for COVID, because it could be around for decades. I mean, the baby you kill, you don't know what's going to happen. You don't know what you might have killed off. The only possible cure for cancer might be gone because of that. Yeah, Israel's headed into turmoil. I personally would not be surprised if 1 million people in Israel die. 1 million Jews, let's say, because as I said, Palestinians generally live in single homes, so the risk for COVID-19 infection is low, whereas Jews in Israel live in like skyscrapers in cities or like apartments in cities, so the chance for death is higher if they open up. So 1 million Jews will die. I mean, there probably won't be that many Palestinians who die. They'll live in really single homes, and there aren't that many deaths among Arabs. So they have the same genetic makeup. Um, I don't anticipate too many Palestinians dying, but I think a lot of Jews would die. I wouldn't be surprised if 1 million Jews die, Israeli citizens who are Jews die by May. If the country opens up, obviously if the country closed, you're going to reduce the death. And that's for every country, not just Israel. England, Scotland, Wales, Northern Ireland, United States of America, France, Germany, Italy, Um, so yeah, if you're thinking about going to a Halloween party tonight, don't. Yeah, that's my advice. Uh, it's like closed indoor space, where strangers are or people but you don't know where they've been. You don't know where it's COVID. I mean, that's like COVID super spreader waiting to happen. I know there are Halloween parties now. Like, there must be Halloween parties today, tomorrow. That you should go to. Just don't. Don't go to your Halloween party. Think of your many, many happy days with your cat. And if you fall in love with some nice guy, many, many days as a wife and a mother. Yeah. You could get a puppy, family puppy. Um, yeah. This is one of my favorite Christmas carols as well. Emmanuel. Well, Jesus already came to Israel, right? you know. Oh, so that's old news, 2,000 years ago, Jesus came to Israel. Emmanuel means God with us. I hope that you'll be well and that your children will be well. And I look forward to seeing you tomorrow. Um, and yeah, let everybody know about this show so they can also survive COVID-19.